Hi, I'm Dr. Tim Watt. I'm the healthy neurosurgeon, and I want to talk to you today about a rather disturbing situation. Your healthcare isn't healthcare. Unfortunately, mainstream medicine in the United States practices disease treatment, not healthcare. Now, don't get me wrong. If you're in an automobile accident, if you have an acute injury or some critical urgent problem, there's probably no place better in the world to be than right here. But mainstream medicine doesn't do healthy. It does sickness. Basically, mainstream medicine is like the fire department. Now, I was in mainstream medicine for 35 years as a neurosurgeon, and it was very rewarding doing neurosurgery. But I came to the realization that fixing people after they were broken was not as efficient as not breaking down in the first place. So what do I mean when I say medicine is like the fire department? Well, if we were having a conversation face to face and I said, what's the best way to keep your house from burning down? You use a qualified electrician, put batteries in the smoke detector, maybe clean the dryer vent, or do you call the fire department after you see flames? I'm pretty sure you'd realize that stopping the fire before it started is the best way to keep your house from burning down. But the mainstream medicine in the United States is the fire department. We wait until you're fully ablaze, we show up, we hose you down, pray there's something left, and then say, call us again the next time you catch fire. Unfortunately, that's not the best way to take care of your health. There's a self-fulfilling prophecy that comes with this disease treatment model, and that is the assumption that we're all in great health when we're about 25 years old. And slowly, steadily, your health gets worse and worse and worse. Finally, you're so miserable you wish they'd pull the plug, but that's when the kids feel guilty and they won't let you go. And by the way, that is when the majority of our health care dollars are spent, when you're bouncing back and forth between assisted living and the hospital. When I left mainstream medicine and neurosurgery and started doing preventive medicine, age management, anti-aging with Synergenics, we shifted our focus to say, what if instead of being healthy and then declining, what if we got healthy and stayed healthy? The problem with this idea that you're just doomed to become ill and frail and elderly is if you sit around and eat the standard American diet, which abbreviates SAD for a reason, if you become sedentary, if you don't address declining hormone levels, if you go to the doctor for 15 minutes once a year and all he does is give you a prescription for pills, yes, it's a guarantee. It's a downhill slide and you're going to get frail and elderly and sickly and be miserable. But that's a choice you don't have to make. The other thing that goes with this mainstream medicine disease treatment model is we frankly think of sickness like it's a vengeful Old Testament God. The assumption is you're just walking down the street, minding your own business, and then wham, you're struck with type 2 diabetes, or bang, you get hit with hypertension. And at that point, the doctor says, here's the drug you need to take to treat your sickness. And no one ever says, wait a minute, what if the choices we made and the habits we had for the last 20 years are why we now have a problem? I had a patient just recently come in. He's got blood sugar problems. He was a type 2 diabetic for a long time, which is classified as having a hemoglobin A1C of over 6.5. His mainstream doctor put him on medication. And when he came in to see me for the first time, he was actually quite pleased with himself, saying, no, my blood sugar is under good control. No, it's not. His hemoglobin A1C is 5.8. That's actually quite high. Healthy is 5.1. Optimal is less than 5.1. But at 5.8, he no longer qualified as being diabetic. So his doctor told him everything was great. Just because you're not bad enough to qualify as being diabetic doesn't mean you're healthy. Yet his doctor was happy with the 5.8, which led the patient to think he was good. And I unfortunately had to shock him a little bit when I told him his blood sugar was still his biggest problem. If we want to talk about healthcare as opposed to disease treatment, then what we want to talk about is not getting sick in the first place. Believe it or not, the majority of the illnesses that are disabling this country, the complications of obesity, the diabetes, the osteoarthritis, the atherosclerosis, to a large extent, dementias, heart disease, even cancer. These are self-inflicted. The problem being, it's not something that happens overnight. It's the end result of bad choices made over and over and over again for a long period of time. What I tell people to think about when they first come to see me in my health practice is, yes, we're going to talk about fixing your hormones. We're going to put you on some supplements. Maybe we'll do some peptide therapies. A lot of fancy, exciting things. Those are all things we're going to stack on top of a table. But the table has 4 legs, and those 4 legs are made up of the lifestyle foundations, which you have to do if you're going to be healthy. And the good news is those lifestyle choices don't require coming to see a specially trained doctor or paying money to go to an advanced clinic. They're choices you can make. The 4 legs are a healthy diet, strenuous exercise, adequate healthy sleep, and stress modulation. Now, you may need some exercise to figure out what is a healthy diet. How strenuous is strenuous? What are you going to do about your stress? So it's a matter of making healthy choices so that you don't become sick in the first place. You want a low glycemic diet, avoiding the processed simple carbohydrates. So when people come in and say, what's the secret to eating? It's meat and vegetables. And they say, yeah, but what's the secret? Meat and vegetables. I guess the secret is corn, rice, potatoes, bread, pasta, and fruit are not vegetables. Plenty of real fibrous vegetables like your mom probably wanted you to eat, and enough adequate protein. Ideally is around 1 gram of protein for every pound of ideal body weight. That's your diet. It's not complicated. Everybody thinks there's got to be some special secret, and the bottom line is all these people are selling books and programs, so they have to have some sort of shtick so that you'll buy their book. Meat and vegetables. Then comes exercise. When people ask me what's the best exercise to do, my glib answer is whatever you're willing to do, because anything's better than sitting on the couch playing Nintendo. But in an ideal world, you have to have a combination of resistance training, some sort of weightlifting, combined with some sort of aerobic training. In a really ideal world, you'd have a little bit of flexibility and balance training mixed in with that as well. Your return on investment with exercise, though, is intensity, not duration. The mistake people make is after I tell them they have to lift weights, they go home, they get a barbell or a dumbbell, and they start picking that up. And 6 months later, they're lifting the same weight. What their body is doing at this point is getting really efficient at lifting that amount of weight, but it's no longer getting any stronger, neither in bones or muscles. So you always have to be increasing the resistance you're lifting. Likewise, if you love jogging or you want to ride your bicycle around the neighborhood, that's great. Again, it's better than sitting on the couch. But if what you want to do is improve your cardiopulmonary function, if what you want to do is really burn calories, then high-intensity interval training, sprinting, is what really works. If you sit on the couch doing nothing, whether you realize it or not, you're asking your body to get weak and get fat, and your body will accommodate you. If you ask it to lift heavy weights, your muscles will get stronger, your bones will get denser. And if you ask it to do intervals type sprinting, your heart will get stronger, your pulmonary function will improve. So your body does what you ask it to do. Sleep is also vitally important. So many people I see are coming from the professions or they're business owners. They're driven, and they tend to say, I don't have time for that. I'll sleep when I'm dead. Well, the problem is if you're shortchanging sleep, you're going to be dead sooner than you planned on. Sleep is when the body does its repair functions. Think about this. Every single mammal sleeps. But if you're an animal out in nature, a rabbit, when you're asleep is when you're at highest risk of predation. So why would sleep be conserved across all species if when you're asleep, you're at risk that something bigger than you is going to eat you? We all do it because it's vital for our health. We need it to repair. So you can't begrudge sleep. You have to prioritize sleep and shoot for around 7 to 8 hours of good quality sleep. Lastly, on those table legs is the stress modulation. Now you notice I said modulation, not elimination. Yeah, you can do some things to get rid of some stressors, but let's face it, nobody has a stress-free life. The in-laws, the kids, the IRS, whatever. There's always something out there that's producing a stress response. What matters is what do you do about your stress. So whether it's formal meditation, whether it's mindfulness exercises, whether it's breathing exercises, going to prayer, sitting on the deck and watching the sunset, it doesn't matter what you pick, but you have to do something to detox from the stress. Let it go. Think about it this way. It doesn't matter how fancy a car you drive. If you push the accelerator pedal all the way to the floorboard and you keep it there, eventually smoke is going to start coming out from under the hood. All right. So you have to be prepared and willing to adopt a practice that lets your body detox from the stresses of the day. So adequate nutrition, high protein, low glycemic, strenuous exercise, a combination of resistance training or weightlifting of some sort, and some type of strenuous aerobics, adequate sleep, stress modulation, letting go of the stress. These things everybody can do, and you can do them without an investment of a huge amount of money. And again, this is the foundation. This is the legs of the table that if you came to see someone like me, we'd have to do that before we talked about fixing your hormones, before we talked about putting you on supplements, before we talked about peptide protocols. When you say, well, why should I bother doing this if I'm going to die anyway? Well, yeah, sooner or later, all of us are going to check out, but wouldn't it be nice if the day before you checked out, you were teaching your great-grandkids how to ski, or you were starting the business you'd always wanted to start when you were younger, but it didn't work out for you? If you don't have your health, you can't enjoy the time you have. And it's a very small investment to make in getting that health that then pays off in long-term dividends of being able to live your life and enjoy your life. I walked away from a very successful neurosurgery practice, not because brain surgery wasn't rewarding, not because it didn't pay well, not because I wasn't helping people, but because I thought I could help more people in a much more efficient manner by trying to get them to learn how to not get sick in the first place. I always tell patients to think about their why, because when I tell somebody, quit eating that garbage, well, they're going to think about how hard that is. Figure out why you would want to be healthy. If you're a parent, consider this. If your child was in a burning building, would you stand on the sidewalk and say, how am I going to get my child out of the burning building? Of course not. After you had them out of the building on the sidewalk with you, you might say, how did I pull that off? But your why would be so big that nothing would get in your way. So when we talk about exercising regularly, when we talk about eating right, if you frame that in terms of, well, these are sacrifices I'm going to have to make, and I'm not going to be happy doing it. Well, good luck making those to a long-term lifestyle. On the other hand, if you frame it as, I'm going to make these choices, I'm going to make these changes because I don't want to have the knee pain. I don't want to get brain fog. I don't want to be forgetful. I don't want to lose muscle mass and become frail and let whichever kid likes me the least be the one to pick what nursing home to put me into. It's really not brain surgery. Don't make it more complicated than it is. Don't wait for somebody to label you as being sick and tell you the answer to your sickness is taking a pill. I'm going to give you one last example about this. I have a lovely lady who's a patient of mine. She'd been a type 2 diabetic for many, many years. She was on 3 different diabetes medications at maximal doses of all of them, and her blood sugars were completely out of control. You can already imagine what our conversations were like. I got after her about how she's eating. Wouldn't let go. Dog with a bone. You've got to spit that crap out. You've got to start eating right. And after about 6 months, the message sunk in, and she came in one day and her blood sugar was absolutely stone cold, perfect, normal. We stopped the first medication that day. 3 months later, her blood sugar was still perfect, and we stopped the second medication. And 3 months after that, her blood sugar was still normal, and we cut the third medication in half. When she came in the first time with a normal blood sugar, she told me, my other doctor told me my medication finally kicked in. I was flabbergasted. Your medicine didn't kick in after 20 years. You did the hard work of changing how you eat. Type 2 diabetes is not a metformin deficiency. It's hand-to-mouth disease. So as soon as this lovely lady quit eating garbage, she no longer needed the drugs. She's not a diabetic. She's not even close to diabetic, and she's not taking the medicines that the other well-meaning doctor had put her on. So if she can do it after 20 years of medication not working for her, you can do it too. And that's my challenge to you. Make the healthy choices.